Hi, everyone. My name is Shireen Haydari. I'm a palliative care physician at Stanford. Thank you so much for joining us. Today's program was made possible by the Stanford Caregiver Center and the Palliative Care Center for Excellence. Our guest today is Dr. Jessica Zitter. She is a national advocate for transforming the way people die in America. She trained at Harvard and UCSF, and she practices the unique combination of critical care and palliative care, and works at a public hospital in Oakland, California. Her work is featured in the Oscar and Emmy nominated Netflix documentary Extremis, and she is also an incredible writer with pieces in the New York Times, Atlantic, Time Magazine, JAMA, and her book, Extreme Measures: Finding a Better Path to the End of Life. It is my privilege to welcome her today. I've had the joy of working with her before, and we're so glad to have you. Thanks so much for joining us.
I'm so glad to be here. And by the way, I went to Stanford undergrad, so it's good to be back.
Welcome back. I think we should just dive into the film and then we can talk about it after.
I'm not going to say I'm not scared. Who doesn't want to just go to sleep and not wake up, you know? Hopefully it'll just be peaceful and quiet and not cause too much pain to the ones I love.
We're just kind of thrust into the role sometimes. And you have to step up.
I knew the cancer was starting to take over. We weren't engaged yet. And I told him, this is your get out of jail free card. Next weekend he came out, pulled out a box. I didn't even open up the box. Just fell into his arms and said yes.
It was a pretty big decision because I basically had to leave work. How are you feeling? Are you comfortable? You're not in pain. I'm not trained for this, but this is the best thing for her.
How are you?
I'm hanging in there. It's a little tough, but I'm doing the best I can.
I'm hoping they're going to do is raise the methadone dose a little.
The decline has been more difficult than I expected. What happened? And I feel like my health is deteriorating with hers. This is a journey for the end of her life, and I want to give her the best care I can give her. It's all about love.
Yeah, thank you so much for sharing that with us. It gets me every time.
Me too. Me too. I was very emotional watching it as well.
Yeah. So we had people send in questions when they registered, and the Q&A is open. So if folks have additional questions, for now, I think, why don't we start with just what inspired you to make this film?
Wow. I watched that film a lot, and for some reason this time it impacted me a lot. This film, I think the best way to describe it is that it was kind of a mistake in a way. This film, I wasn't even really thinking of myself as a filmmaker when I started filming this film. It was around the time that my book was coming out. It was around the time that Extremis was coming out. And I knew that there was a tremendous power to film. Yeah. And Bambi, as you could see, is just this dynamic character. And she gave me this opportunity. She invited me, and once, she was going down what I call the end of life conveyor belt, having a very difficult death, and called me and said, I need help. And we very quickly got her into hospice, and everything turned around and all of a sudden was so positive, and her sons flew in, and it was just this beautiful moment. And I thought, let's document this, and Bambi was all for it. Let's show what it's like to be a person who faces, with courage and planning your eventual death. And I didn't realize that the film was actually going to end up being about her husband. I honestly didn't. I thought he was going to be the guy who opened the door for hospice. I didn't understand what the film was about until long after Bambi had died, and I saw the first rough cut of the footage. And when I watched it, I realized, oh my goodness, this is a whole different story. I didn't really know about family caregiver burden. I'm going to confess this to this group. You're a palliative care doctor. I'm a palliative care doctor. You would think if anyone would know about, what's going on with caregivers, we would have this holistic. I didn't know. I didn't understand until I followed my own friends home and then started filming them that this is a public health crisis. And then when I started to realize that, we had to do some big editing of you can feel the change in perspective, right? The film starts out being about this woman, and it turns perspective in the middle and becomes about her husband. And we actually had to capture some other footage afterwards. And you have to, you think documentary is just the truth, but it's a story. It's still a story. And the perspective changed in the middle of capturing the story. So as I realized that this was what this story was, and I wanted to create a keynote around it like I did for Extremis to sort of put context to it, because I think the verite style of this film is powerful, but it needs some context setting. And so I have created this talk, and I started to learn more and more and more about family caregiver burden. And I was aghast, really, at the sort of extent and depth and growth of this public health crisis. It's a silent and invisible crisis that is among us all. That is one that even I, as a palliative care doctor focused in the hospital on patients, hadn't picked up. That was a long answer to your question.
Yeah, it's okay. I don't think you're alone in that, right? This is not something, I think, for many of us, we see the world that we operate in and not necessarily what happens, especially for healthcare workers who work primarily in hospitals, unless you've gone and done home visits or you've been a caregiver yourself or experienced it in your own family. And I think, what's so striking is so many of us have been or will be caregivers, and there's not a lot of training. I think, Rick actually said, I'm not trained for this, right? And yet we become caregivers. What are some of I know the film brings it up, but what are some of the challenges that you see and maybe that came up for you watching this back?
Well, it's interesting. I'll give you an example. First of all, just to put an exclamation point on what you just said, 1 in 5 and growing, 1 in 5 Americans is a caregiver right now. Sorry. This is a real serious, deep public health crisis. It's not just elderly spouses. We are talking a quarter of caregivers are millennial. Mm-hmm. There is a tremendous disproportionate impact of caregiver burden on people of color and minorities and people of lower income. This is, a really serious, deep crisis that we need to be aware of. But what I wanted, a quick anecdote to answer your question about what do I feel when I see this film. When we have created a short workshop for trainees, like medical students and residents, around family caregiver burden. And I was so struck when we showed it actually to one of the UCSF groups, and we're going to be showing it to a few more, that when the lights came on after the film was over, half of them were crying. And one of them said something which I thought was just so powerful. He said, during COVID, I was following a neurologist around, and we were seeing this patient who had had a stroke. She'd been in the hospital and she was discharged to home and she was doing okay. And we were so focused on the fact she's home and her rehab had helped and she could transfer and she could do it. He said, but now I'm thinking, after watching this film, I'm thinking about her husband of 40 years who was on that call with us. I wasn't even thinking about him. I was thinking, aren't you glad your wife's doing so well? I wasn't thinking about what he was going through and how this must be impacting him. So I found that powerful. And I think that's the same way that many of us practitioners who aren't necessarily thinking about the caregivers, how many times have we discharged people home on hospice? It's going to be great. And they show back up in the emergency room. My social worker's never surprised by it, but I am. I'm like, I wonder if this family wasn't ready for hospice, or I wonder if this wasn't a good hospice agency, or, we're just not grasping this crisis to the level that we need to.
Yeah. And many people, and I think this is coming up in the Q&A, are caring for family members for years, that it's not just, a few months. It could be a role that they're in for years, and the toll that takes. on a physical level, on an emotional level, on a financial level, I think is really striking. Can you talk a little bit about resources that are out there for caregivers? And I know we've got folks on the Stanford Caregiver Center on the call as well. So those resources are actually open to anyone. You don't have to be a patient at Stanford, and I think they'll put the website up again. But what resources did you discover as you were kind of delving more into this?
Well, first of all, I just want to highlight again what you said, which is Rick, this is really important to understand. We all have this emotional experience watching Rick, and it's so powerful. And then the surprise and suspense as his granddaughter is revealed, etc. Rick was one of the lucky ones. Let's not forget that. Rick did this, intensively for 9 weeks. The average family caregiver does it for 4.5 years. Rick, his savings carried him through. There was help. People in the community were helping. 30% of family caregivers use up their savings, right? Think about Bambi as a care recipient. I mean, Bambi was doing everything in her power to help Rick. She was appreciative. She said, if I have to wear Depends, I'll wear Depends. She was the ultimately appreciative. But how many care recipients are demented or combative or depressed or frankly, were neglectful of the care provider? I mean, there are stories that I have heard now that I've gone into this work that are, of caregivers who are providing care to people who may have abused them, may have neglected them, with whom they may not have a good relationship. This is, Rick was in a really as hard as it was for him, and you could see how hard it was. Could he have lasted another even week? I'm not sure. And think of the people who are doing it with so much more challenging. So the burdens of caregivers really just expand to the entire realm of human experience. They're financial. People's work is impacted. They spend a very large amount of their own money doing caregiving tasks. So they're decreasing their income like you saw Rick do, and spending their own money. I mean, this is not compensated in any way. They're doing incredibly large amounts of work. As you saw, the average caregiver works 24 hours a week. That's a lot of time. There's the financial piece, there's the healthcare, as you alluded to. Family caregivers suffer real serious medical and psychological burden. In fact, there's even inflammatory markers and lipid levels and things are found to be more elevated and more problematic in caregivers. But certainly during the pandemic, the August morbidity mortality weekly report did a study on caregivers and showed in August of the pandemic that over the previous 2 months, caregivers were one in three caregivers was seriously considering suicide, had seriously considered suicide. That's 10 times the amount of the general population. I mean, the psychological and emotional and physical compromises that caregivers and burdens that they experience is powerful. So that was just a sort of background to, okay, so what's out there for caregivers? Well, let's start with what's not out there.
Okay.
I mean, we've got the Stanford Caregiver Center, which is a profound and amazing group. Thank you, Amy, and thank you, the Stanford Caregiver Center. But most caregivers don't have a lot of support. They don't have the Stanford Caregiver Center. They don't have the VA program, which, by the way, is a fantastic program for caregivers. They don't have private insurance support and coverage. Private insurers don't pay for this. Medicaid, yes, it does a little bit. IHSS, we've all heard of in-home supports. They pay, which pays minimum wage for a certain number of allotted hours, and it's usually used by the family caregiver just to supplement their income. You can't use that money to hire someone to come in because it's usually costs $30 an hour to hire even an aide. So if you're getting paid minimum wage, I mean, what are you going to do with that money except put it in your pocket to offset the losses? Adult day programs, yes, that is a wonderful program, and respite. But again, those are, you have to, for Medicaid,
So small.
and to qualify for those benefits, a lot of people have to have a very low income, and people like Rick wouldn't qualify for them. So we really don't have a lot of coverage and support. Now, on the other hand, there are resources out in the community, and I'm actually still trying to, and Amy might know this number, but I have heard, and I'm still trying to validate or confirm this number, but that 4% of caregivers are utilizing resources that are out there. Now, I'm still trying to find out if that's true, but it's a very low percentage of people. There are respite programs. Obviously, Rick got his through hospice, but there are other types of respite programs that can be accessed. There are transportation support, meal support. As I said, there are programs. And as I mentioned, this VA program, which I'm just starting to learn about, is something that's, I think, a real gold standard. And I wish would be available to everybody. But, there's a mismatch between what's there and who's accessing it, and the ability to navigate and figure out. I mean, most caregivers are so overwhelmed, they don't have time to go researching this stuff. There's nobody looking for them and saying, hey, I know you're a caregiver. I want to match you up with some resources. That kind of thing isn't happening. So
well, you mentioned there's no national strategy, right? So there's not like a central place to say, okay, what are the resources in my area? How do we support these people? And for those who are caregiving full time, have to give up their jobs or can't manage both because they're caregiving 40 hours a week or on call 24/7, as Rick put it. How do you even know where to look? I think is a huge problem. And so increasing awareness really becomes key.
Absolutely. But I will say one thing.
Yes, ma'am.
These are formal resources that we're talking about.
Yeah.
There are also informal resources. I call it homegrown help. And we created a caregiver workshop around the film for family caregivers that we piloted a couple of times. We'd be happy to give to the Stanford Caregiver Center to use. But we have, a worksheet that really says, let's get you guys to think about your innate native resources. Like what are the things you need help with? I mean, Rick needed help with laundry. Do you know how much laundry Rick was doing?
Probably a lot.
A lot. And so frankly, a couple loads of laundry a week offset could have given him some precious time back. People from our community, we are all about bringing food, maybe food, having specific types of food, or somebody coming to clean out the refrigerator to make place and to, those are the kinds of things that I think is, if we could figure out how to organize, and a community like ours, for example, could figure out how to organize that kind of thing and really have a protocol for figuring out how to match what Rick needed and what would have been helpful to Rick with what people could do. There's a lot of stuff that could have been delegated. He said at one point, it was a fiasco when I let somebody put her on the commode. Okay, so so you be the person to put her on the commode. But there's other stuff that people can take from you.
Well, like that laundry, right? I think that's a question that comes up, came up when people submitted questions is, okay, how do I concretely support someone I know who's a caregiver? And I think you bring up a lot of great points, right? That a lot of people get food and a lot of people come visit. And, I think he said visits aren't a respite for me, right? So what are those tasks, whether it be laundry, whether it be helping with Maya, whatever those things are, but concrete asks that can then be delegated. And I think, how do we figure out that list, but concrete things rather than kind of how can I help? Instead it's, okay, I'm going to the store. What can I get off your list? Or, what kind of things can I take off your plate? It sounds like you're saying is a place to start just in terms of how to support someone. And
in modern day America, many people do not have an organized community with that has its little, committees for this, committees for that. For those communities, get your committee, your family caregiver committee. That's the first thing I would say. Get a family caregiver committee. But for people who don't have an organized community, there's still neighbors. There's still friends and family. And if we can raise awareness as a nation about this epidemic of family caregiver and make people feel that empathy, because not only is your neighbor experiencing it, but you're going to experience it one day. And have us come together. Again, this is not a substitute for a national strategy, mind you, but it's a temporizing measure for us. And what can you do for your neighbor down the street who's now a caregiver?
Yeah. What do you think our responsibility is as healthcare providers who are now becoming more aware of this? How do we, aside from making this film required viewing on every, medical campus, how do we spread the word? How do we think about these things as we're kind of, taking care of patients who ultimately will not be under our care? How do we do that?
Well, I'm so glad you asked that, because I gave the wrong answer to that question and was corrected a while ago. I don't know if any of you know Tali Ziv, who's fabulous. She's one of the people who runs the CLICK program at Kaiser on the East Bay. And I said to her, I said, I don't want to upset. We were talking about this program for the young medical students. I don't want them to feel, this frustration that their awareness is raised about this issue, but they're still working within this hospital system that frankly is not doing this well. And so is that just going to raise frustration and make people unhappy? And maybe what we should tell them in this presentation is, I'm wanting to raise your awareness, but I'm not necessarily able to give you any tools. So I'm sorry, just wait till things get better. And she said, no. She said, you know what? My father died. It was a couple of years ago. And she said, I remember we walked into a physician's room. Our physician walked into our room, and she looked at my mother, and she said, I think it was at Stanford actually, maybe. And she said, how are you doing? She said, just the looking at my mother and noticing her and naming her and naming her issue and acknowledging what she was going through was so therapeutic and so important. So I think that is the first and most important essential step, is that we not let these people be invisible anymore, that we acknowledge them, that we feel connection with them, and that we tell them that they're a part of it, that we include them as part of the care team, that we prepare. There's an act that was started in 2014. AARP put forward this proposition that became law, but then is now in 14 states, or maybe a few more, called the CARE Act. And Amy, or anyone can correct me, but the CARE Act, which is caregiver, oh boy, I'm not going to remember what it stands for. But the intention is that hospitals within the states where this is law are required to identify caregivers prior to discharge of a patient and make sure that they are prepared and trained. First of all, I have polled, it is law in California. I have polled, I think now probably 18 physicians and social workers. People don't know about it. People have never heard about it. That is a law that should have teeth. It's important and it's well-intentioned, but we have to have it have teeth. Every caregiver who is going to be taking a patient home must be prepared for what this is. They must understand that a discharge with hospice, still, there are many caveats. They're going to be performing the bulk of the work. They need to understand that before they go home. Many people have no idea. And hospice gets blamed, by the way, I think unfairly, for caregiver burden. Are there good hospices and bad hospices? Yes. Are there good hospitals and bad hospitals? Yes. But hospice isn't there to manage caregiver burden. That's not what they get their $200 a day for.
They can't, just based on how they're funded, right? The same way that our system isn't currently set up to reward caregiver labor. I mean, I think the amount of unpaid labor that caregivers provide every year is staggering. And, life doesn't stop. I mean, we saw it in the film. I think many of the people on this call have experienced it, where, you're waiting for the grandchild and you have a 3-year-old playing on the floor while all of this is going on around, and none of it stops. So how do we raise awareness? How do we say, okay, we have to help prepare people, but we also need to financially incentivize the system to do better.
We have a workshop that we're creating right now for hospice staffs using the film, so that we could sort of, have hospice. And it was interesting because a lot of hospice people who are helping us with this program were like, we really, hospice, we're afraid that this is going to make hospices feel attacked. And I said, the point of this kind of a film is to acknowledge any feelings of defensiveness that a hospice might feel about being responsible for family caregiver burden, supporting them through that, because they're getting, I think, unfairly blamed for this problem. And then also at the same time, helping them think about what they can do in their homegrown way to just help their caregivers a little bit more, given their limitations. But yeah, this is a big problem that needs a national solution.
It's really hard. And I'm grateful for many people who are looking at this issue, because I think we need to. I'm looking at our Q&A, and a couple of people have brought up, I'm curious as to your thoughts. A couple of people have brought up just how caregiving can impact family relationships. If, for example, there are siblings who are carrying more of the role than other people in the family, how to manage those relationships without kind of internalizing some of the disproportionate kind of effort, I guess, is one way to put it. Do you have any thoughts about that? I know it's a hard.
So many thoughts. And actually, in a way, it parallels what we do as palliative care physicians, right? Because when just in the hospital environment, when decision-making has to happen around serious illness, there's the sister who flies in from the coast, and well, we're on the coast, but there's the sister who flies in from the Midwest, and there's all the emotions that come up with families, and that can break families, right, around serious illness and serious illness decision making. And it's the same thing here, but it's more insidious, because in a way, this sort of caregiving role happens over time. One person kind of takes on, and then all of a sudden it's the status quo in that family, but it's been going on for a long time. And I was interviewed by an amazing woman on the Daughterhood podcast, and who's a caregiver, and she is the designated caregiver in her family, and she's exhausted. I mean, the stories are profound, and it's just become the norm in the family. And she isn't necessarily a person who stands up and says, "Hey, I need you guys to stand in here." So this is another example of why advanced care planning is so critical, because advanced care planning about the caregiving strategies in a family are really important. I know my mother's on this call. Mom, we need to talk about this. My sister and I, my parent, we need to have a plan.
Yes.
This is an advanced care plan, just like breathing machines are.
Yeah.
How are we going to take care of mom and dad? Mom and dad, we love you. We want to make sure that this is, that everybody does this in the most sustainable way.
Yeah. You're not alone in teasing your family about needing to have those conversations. I've definitely done it. And Mom, we need to do it too. No, I appreciate that. I think another thing that came up and is just kind of how to meet emotional needs as well as physical needs, that as a caregiver, there's kind of all these things that need to get done. And, how do I meet the emotional needs of the person I'm caring for? How do I balance those things? And this isn't part of the question, but I wonder too, and, then also take care of yourself, right? Which is a huge piece that gets lost sometimes in caring for the people you love, whatever the situation may be, short-term, long-term, what's going on.
Well, you're some good questions. One of the things that when we were designing the family caregiver workshop, I remember sort of feeling like, it feels so kind of trite to say to a family caregiver, you need to make sure you take time for yourself. Like, who has time? The definition of family caregiver burden is you don't have to. But what I have found now in talking to family caregivers, and I'm sure it's different, every person did, but I've been surprised that the family caregivers I have spoken with and the professionals who work with family caregivers really believe that reminding family caregivers about taking time for themselves and doing something that's sort of restorative to their lives on a reasonably frequent basis is a very, very important part of running this marathon. Mm-hmm. And what that is going to be different for every person. Obviously, that's, again, caregiver specific decision making, just like patients, you have to get specific. What is it that regenerates you, that restores you? Is it making jam? Is it getting on the phone with a friend? Is it having a glass of wine? What are the things that you can do to restore? And I think this is something we can be helpful with caregivers, is just finding some little thing that's going to be restorative. But the question about the emotions of the patient and the guilt of the caregiver, here's the caregiver who's being run ragged, right? Mm-hmm. And resentful, Rick says, and he says it kind of in an abashed way, this is not what I signed up for.
Yeah.
And here she is dying,
mm-hmm.
right? And he's feeling these feelings. How do you process that? I mean, the fact is, those are normal feelings. Like that is a normal response, what Rick had.
Yeah.
And yet he loves Bambi, and Bambi's dying, and Bambi's suffering. I don't have an answer to this, but I do know that these are real experiences. The guilt of the caregiver, the loneliness, the resentment of the caregiver. I think caregivers need and deserve some sort of counseling support. Maybe this is part of the national strategy, even if it's a 5-minute day. I don't know what it is, and it might look different for each caregiver, but some sort of support to normalize their experience, to allow them to express themselves without guilt. I think that's a very important part of this restorative activity that we can help caregivers with as well.
For sure. I think holding space for kind of all of the emotions that come up and saying, okay, what are things that you want to do for yourself this week? And what can I do to make sure that you get the chance to do that, whether it's go out for 4 hours to do the things you want to do.
Yeah.
What are some really positive things that have come out of this? You mentioned some projects that you're working on already. Are there other kind of positive things that have come out of making this film and having these sessions and talking about what are things that excite you moving forward?
Well, first of all, as you can probably know, I'm a storyteller. I like telling stories. I feel like stories, especially visual stories. I'm a writer, and I love to write stories, but I feel like what I'm learning about film, bringing people up to the bedside, whether it's in the house or in the intensive care unit, it is a very mobilizing experience for audiences, whether they be audiences that are, lay people or healthcare providers. Those are the two main groups that I think that they can be very, very mobilizing. And then I think you can use them to impact behavior and change and policy, et cetera, by having context around them. So I feel like, being that this is sort of the second movie that I've been involved with, now I think I've kind of realized that movies are something I want to be involved with. So that's exciting. I have a lot more that I want to make.
Excellent.
So that's we've got to talk about that. I think obviously the caregiver piece. I mean, just for me, what everybody comes to the work of palliative care from a different perspective. And I've met so many people come to be palliative care practitioners or people interested in the death movement who come to it for different reasons. I mean, I would not say that I have come to it because I like to think about death and dying. Some people do, and I respect that tremendously. But for me, the reason I came to this was because as an ICU doctor, I felt that there was a very uncomfortable, what I would call an injustice in the fact that people were suffering because they didn't have full knowledge of what was going on with them. And I knew what was happening with them. I knew what was going to happen likely with them. And they didn't know. I hadn't transferred that information because that's how our healthcare system works. And that's why I got involved with palliative care. And that's why I really believe in the communication process and how important it is. And I see it as a justice issue. This is the same thing. Now that I've learned about caregiver burden, it's another justice. It's another cause for raising the alarm and saying, wow, this is happening. We cannot allow this. This is unjust. How can you have this huge number of people, a fifth of the American population, providing care with no support, no financial support? It doesn't make any sense. It's unsustainable and it's unjust. So I feel lucky to have learned about this issue through this film. And now I feel like this film could, if it goes to the right places, which I hope it will, it can possibly make an impact. It's I believe short films can really be useful that way. And I'm hoping that we're working on it. Impact with a film is very hard. I will tell you, it's harder than you realize. It's a lot of phone calls. It's a lot of trying to make connections. And I'm also very busy. So I don't necessarily have all this, it's tough. And help anybody out there. If you have, we want to get this. I'd like to get this. I'd like Joe Biden to see this. I'd like to get this to Congress. I think this is a Republican and Democrat issue. Like, let's get people to see
It's a
this
human
together.
issue.
It's
a human issue, right?
Yeah.
It's part of living well as long as possible, living as well as possible, which I think is a huge part of palliative care.
Yes.
Is how do we make each day as good as possible?
And sorry to interrupt, but
no,
when we play that game, Go Wish, what is the thing that I see the most as the top card? That's, where you
Yeah.
up with what are your values about how you want to live? Not being a burden on people. That is the one I see the most. And caregiver burden is by definition going against most people's desires about how their lives are going to go all the way into the end. If we are putting burden on all of these people's families, we're not doing justice to any of this. It's not right.
It's not. And I think we should take this as a call to action. I hear it loud and clear. And we are at time, but thank you, Dr. Zitter, so much for joining us. I hope that this is one of many sessions that we'll be able to have around caregiving and just bringing kind of light to issues in medicine that many of us aren't as aware as we should be. So thank you all so much for joining. It's been a privilege, and take care.
Thank you. Thanks for having me.
Bye, everyone.
Bye-bye.